The object of this broadcast is to bring to you and to your attention the number of great qualified physicians we have who live and work in the Troy area and are associated with the Troy Regional Medical Center. Dr. Tom Peurifoy is with us today. And Doctor, may I call you Tom?
Absolutely.
All right. Basically, we're talking about surgeon,
Yes, sir.
general surgery.
Right.
We're going to talk doctor stuff here in a minute. Let's talk Tom stuff.
Okay.
Right now. Basically, what makes Tom tick? What's your likes and a little bit about you?
Well, fortunately for me, I really enjoy my job, so that comes number one. Number two, I like to get outdoors, play golf at the club, and go to the football games and the Troy University productions of various kinds.
Now, you find that available from time to time among your being on call. And I understand that you spend a lot of time on call. You likened it unto a fireman. The fact that there are fire and police and other areas you are on call for a certain amount of hours, and that's the way general surgeon is here in Troy.
Along with Dr. Gill, my call partner, we provide 24-hour-a-day service, 365 days a year. We cover anything that comes through the emergency room, anything that's urgent.
Well, let's talk about for a minute here from the surgeon standpoint. What really can you do at Troy?
Well, we've got all sorts of diagnostic abilities. We have CT, MRI, of course, all the lab work that you could consider normal stuff. We have endoscopy. We have all sorts of surgery, thyroid, breast, from biopsies to treatment of breast cancer. We do lots of laparoscopic surgery, such as laparoscopic cholecystectomy, hernia repair, colon cancer.
A question that I would probably ask then is, why should I have to go someplace else?
That's the way we feel about it. We need to support our hospital like we need to support our sports facility. We need to support Troy University. We need to support the local restaurants. We need to support our downtown merchants. Yeah, well, we need to support our hospital in the same way.
How long have you been in Troy?
I've been here a year and a half. The hospital has all the facilities that I need to do my job, and we would like to extend to the community the opportunity to have their care given here.
Under most circumstances, your services and expertise, another physician would send their patient to you.
Correct. Normally, I would be what's called a consulting physician. The primary doctor would be the one that sees the problem with the patients. They're the ones that know the patients the best. And if they have a specific surgical problem, then they would refer them for evaluation and treatment.
Have you always wanted to be a physician and particularly a surgeon?
Actually, I kind of always did. When I was 12, we were involved in kind of a minor auto accident, and I always thought, now what would I do for my family if something happened? I need to be the one that knows what to do and the one to be able to do it, and kind of from then on, that was for me.
Where did you get your schooling?
Well, I went to Lamar University in Beaumont, Texas, undergraduate, and then spent 9 years in Galveston, Texas, at the University of Texas Medical Branch.
Yeah.
Finished there and then went on to work in Biloxi, Mississippi, and then spent 20 years in Florida prior to coming here. Gulf Coast is where my heart is.
We're glad to have you in Troy. We really are.
Well, I think it's a great opportunity for me, and I certainly hope it's a good opportunity for my patients to get treated here.
Tell me your honest opinion of the emergency services available at Troy.
Our advantage is that we're here for you all the time. There's no big wait for your service to be done. There's not 45 people ahead of you with non-emergent conditions. You come in with lacerations, chest pain, auto accident, you're going to be seen and treated immediately. So there's no delay in getting in.
How do you feel about surgical facilities, since that's your expertise?
I think they're very adequate. There's nothing there that we need, and if there is something there that we need or think we need, then the hospital is very good about getting that equipment for us in a timely fashion.
Are we at the position that you have a regular surgical schedule?
We do. We have what we call block scheduling, and then doctors know when they'll have a time available, and that time will be their time, so they can schedule their cases. Plus, you have the option of asking for more time or bumping a case if it's an emergency. And certainly, we operate 24 hours a day. There's no delay if a case comes in and needs to be done right away.
Just an overview opinion of the upcoming medical programs that we're looking at, particularly the federal medical.
You know, no one, even the feds, don't really have a handle on how that's going to hash out. They're talking about adding 30 million people, but no new physicians. So right now there's already a surgeon shortage. The average general surgeon is 58 years old. So you got to keep that in mind, that the inflow, the new ones coming up the pipe are slow to progress. There's been some changes in their training in the past. They're limited hours now, as their service hours are limited to 16 hours in a row, where our limited hours used to be 36 in a row. So their training is slower. They'll be coming through slower. They'll have fewer cases under their belt, and so we'll have to see how that works out.
Thank you. This broadcast brought your way by Troy Regional Medical.